Thank you, Mister. Thank you
so much.
So many of us here have been to a doctor's office or have been hospitalized. When you go to a doctor, you have concerns, and you expect your doctor to listen to you, try to think about the problem, perhaps do a physical exam. But many times the doctor wants more information. There comes labs, blood tests, urine tests, x-rays, CAT scans, MRI. So what does that mean? Perhaps you have to make another appointment to get all these things done. And what happens after that? Somebody has to interpret. That means you have to reschedule or revisit. If you're lucky, you probably will get that done in a couple days. More often, it takes weeks. Now, wait a minute. If the same doctor had a tool that enabled him or her to look at the problem, to look inside the body right at that first visit when he or she is talking to you, would that be important? If that could make the diagnosis right at that first visit, would that be important? If that would cut down tests, would that be cheaper for you? Welcome to ultrasound technology. Wait a minute. What am I talking about? Ultrasound has been there for half a century. But up until a few years ago, these machines were huge, heavy, bulky, and very expensive. Not too many people in the world could afford them. So let's fast forward. Over the past couple years, maybe a little more than a couple years, technology has gotten smaller. With the help of innovation and technology, these machines look somewhat like this. And many of them are not any bigger than my smartphone. So if a tool gets smaller, lighter, portable, more mobile, and more importantly, cheaper, maybe more physicians can afford them. So what about the physicians in other parts of the world trying or struggling to make a difference in the lives of their patients? So with this in mind, we at Sanford Health, and with the help of the Sanford Health Foundation, were able to secure 12 of such portable machines that we are now using to teach our medical students and medical residents. We have 32 of them on a month-by-month, one-on-one basis, with the hope that after 3 years of training, all the students would have the competence, proficiency, comfort level to use these machines on every patient right by the bedside, right in their offices, and perhaps make a difference in efficiency of care, cost of care, and thereby improve the human condition. So, 3 years from now, if your doctor happens to be one of us trained in this procedure, it would be okay if you had to stop your doctor and ask, so what about that handheld ultrasound? And don't be amazed if he or she turns right back, gives a grin, and tells you, you betcha. Thank you.